Hey everybody, it's Faheem from Subscriber, and I've got my colleague with me here today.
Hi, myself Mohammed Ilyas. Actually, I'm a student mentor who works closely with the pharmacist. And today, in this video, we're gonna explain the things how the pharmacists work in the general practice.
Brilliant. So, like Ilyas said, this video is going to be about all of you folks who are either thinking about going to general practice, perhaps you're already working in general practice, or you want to learn more about what is the role of a pharmacist in general practice. So like always folks, subscribe, like and share, and let's get into this video. Right, I'll start. Ilyas, as you can see, is ready to go and eager, but I'll start this one. And I want to make clear, initially what we're going to do is we're going to be talking about defining what is general practice. I'll be giving some input, Ilyas will be here as well. Then what we'll start to look at is some of the core skills that are required for you to be able to work in general practice. Then what we'll do after that, we'll break the video and we'll have the second video. And in the second video, we're really going to be focusing on what sort of activities and roles have to be done in general practice, what sort of salary can you expect in general practice, perhaps some of the limitations in general practice, why you should work in general practice, what to consider in general practice, and most importantly, we're going to be telling you how Medlearn can support you to develop your skills, whether it's clinical, whether it's leadership, whatever is required, whatever is required to work in general practice. That's what we're going to do. So, Ilyas, when we hear the term general practice, what I think of is I think about general practice as a place where we have a group of professionals, for example, a pharmacist, a nurse, a doctor, who is working together to improve health outcomes, correct?
Yes.
However, it is different to what we do here. In a community pharmacy, we've got medicines and we dispense medicines. But in general practice, things are a bit more different. Can you briefly summarize what happens in general practice?
Well, in this case, in general practice, doctor gonna diagnose the patient and the pharmacist gonna treat the patient. That's how it works. That's how the relation is in between both of them.
Brilliant, great. So let's actually write this out. I've got my pen. Dr. Farooq, and I like to call him Dr. Farooq because just like Dr. Dre, he's the real deal. Let's think about this. We have here, we have the GP, the doctor, and here we've got the pharmacist. Okay, traditionally what happens, like Ilyas says, is the doctor will see the patient. Okay, there's our patient. And the doctor will diagnose, and we're going to put DX as diagnosis. You then have the pharmacist who receives this information, and the pharmacist will then begin treatment. That's the relationship, and it goes back and forth. So the doctor diagnoses, the pharmacist treats. And that is the basic relationship that we can say, or the basic role of the pharmacist within general practice, where you've got the GP diagnosing and the pharmacist treating. However, what we're finding now is the pharmacist, and this is important, the pharmacist is also playing an active role in treatment and diagnosing. So yes, they're involved in the treatment side, we'll explain this in a bit more depth, but they're also actively involved in diagnosing. So what that basically means is, when you're going to be working in general practice, you have to have a range of skills, a range of what we say competencies to work in general practice. Because yes, you're going to be involved in treating. Yes, you're going to be involved in recommending medication and talking in a lot more depth about medicines, but also another area like Ilyas mentioned that you're going to be involved in, and that is the diagnosis. So Ilyas, tell me briefly or summarize 3-4 skills that you think, or core skills that are going to be important to work in general practice.
Well, in this case, what's the role of decision making in this one?
Okay, so he's mentioned decision making. Got a good point. And there's 4 or 5 different skills that have to be developed. First one I'll touch on is medicines optimization. Then we'll talk about clinical decision making. Afterwards, we'll then move on to the communication skills, then technology, and then we'll talk about something that's quite important, that's empathy. These are the different skills that are going to be required. Okay, so first of all, medicines optimization. What does that mean to you if I said medicines optimization? Any ideas?
like improving the medication by looking over the prescription, like whatever the doctor prescribed to the medication, the pharmacist analyze everything if is properly suitable for the patient, looking at the lifestyle.
Okay, he's onto something. So you're working general practice. You have a patient. The patient's been diagnosed, let's say, with high blood pressure. Okay, the doctor prescribes him 3 medicines. You as a pharmacist will be playing a role to make sure, one, are those medicines at the right dose? Are they evidence-based? Is that the best treatment for that particular patient? Do you need to intervene somewhere? Okay, that's what we're talking about, medicines optimization. When we're talking about medicines, medicines can be thought of as an agent that can give some sort of therapeutic benefit. So they give some sort of benefit to the patient. Okay, that's what a medicine is. It's an agent, it's a tool. Optimization is all about making sure that whatever we're giving these patients, these medicines, they're at the right dose, they're at the right strength, they're evidence-based, and they're doing what they need to do while reducing or limiting their toxic side effects that they have. And something I read importantly, a medicine that doesn't have side effects probably has no effects. Okay? Think about this. A medicine that has no side effects probably has no effects. So what that means is that medicines will have side effects, but we need to make sure that their side effects are minimum and that the medicine is optimized. So let me give you an example of a patient who has, let's say this person has, for example, high blood pressure. Patient has high blood pressure. The GP prescribes him and this is not an ACE inhibitor, but imagine this was an ACE inhibitor, something like Ramipril. Okay, the GP prescribes Ramipril. Now the patient presents with back pain. You as the pharmacist will have to get involved and need to know actually that if this person has high blood pressure and is on Ramipril, he's got back pain, should I be prescribing him an NSAID like ibuprofen or naproxen? And that's where you'll step in, you'll say no, because if you prescribe an NSAID with an ACE inhibitor, there's an increased risk of injury to the kidneys. You see, you're involved in medicines optimization. Instead, you might go for a gel perhaps, or go towards paracetamol. You see how you're getting involved? Maybe we've got this patient now who was at some point prescribed something for their back and was given an NSAID. Let's say they never had high blood pressure and they've been continued on a proton pump inhibitor like omeprazole. You as the pharmacist will step in and say, actually, you don't need omeprazole anymore because you've now stopped your NSAID. So you can see you're actively involved in medicines optimization. And folks, for any of you folks who are interested in getting into general practice and you need help with developing your skills, whether it's medicines optimization, structured medication reviews, getting ready for general practice, get in touch with us at Medlearn. We have plenty of courses that can help you, from diabetes to hypertension to asthma to COPD, chronic kidney disease, you name it, we've got it, we're there for you. So medicines optimization. Let's see how good Ilyas's memory is. What's the second skill?
Well, the second would be how the role of the clinical decision making.
Brilliant, clinical decision making. So as a pharmacist, I've already explained the picture to you. You've got the GP, you have the pharmacist, you're involved in diagnosing, and you're involved in treating. So clinical decision making. Clinical decision making, we can define this as higher order thinking. So we have levels to when we think. We've got a basic level, like when you're in school and you're learning a word, you might just rote fashion memorize the word. That's basic thinking. You don't really understand, but you're memorizing. How do I spell script? Or how do I spell script? How do I spell script? S-C-R-I-P-T. That's basic. But now imagine you were given the task to write a story about a script. And you can see all of a sudden you have to think higher level, that actually I've got to create a story. Similar to clinical decision making, just listen on here. Clinical decision making is a higher order thinking. Is where you have a problem. So you've got a patient who presents with a set of problems. You have to diagnose that patient. You have to treat that patient. You have to manage that patient. And that is a lot. That is huge because patients present with signs and symptoms. You have to know, okay, this person can have diabetes, or it could be hypertension, it could be pneumonia. So it's a very, very important skill that you have to develop. Another example I'll give you is a diabetic. Let's say you've got a diabetic patient who suffers with diabetic, and his sugar levels, and we can see there's noise in the background, and his sugar levels are not controlled. So he's on metformin, he's on, let's say, glycoside, and the HbA1c levels are not controlled. What do? Do you consider a GLP-1 receptor treatment? Do you consider probably like something like SGL level 2 receptor. What do you consider? And let me get the wording right, actually, folks. As you can see, some of these terminology can be quite confusing. As I mentioned, GLP-1 receptor agonist or SGL2 inhibitor. What does that mean? Well, we know that the glucagon-like peptides, we know that these particular medicines play a role in weight loss. If you felt this person needed also help with weight loss, you'd consider the GLP-1. Or perhaps this person also has a risk of cardiovascular disease. That's when you'll go and look at an SGL2 receptor treatment. So you can see you have to make the decision. You have to know the condition inside out, because how can you treat diabetes without knowing diabetes? And you're going to be actively involved in which treatment options to give. So 2 skills we've touched on already. Medicines optimization and
clinical decision making is done. So the next one, the role, how the communication skill works.
okay, communication skills. Communication skills, again, very, very important of the role of the pharmacist in communication. How do you define communication? What do you think communication is? What are communication skills?
How better you can explain to the opposite person.
Okay, so most people think communication is just verbal. Communication, we can define this as a set of skills or tools that can be learned and developed. It includes your speech. It includes how you look. It includes your body language. It includes everything that you are absolutely giving across to potentially the person in front. It could be how you write a letter. It could be anything. So communication skills are very important because you're going to be dealing with people, and how you communicate to them, the language that you use, the way you get that information across, of course, is going to be very, very important. So communication skills is very, very important. And that is something that absolutely you need to be able to develop. Let's say you have an elderly person who has been informed that they're at increased risk of a heart problem, and they need to start to take a statin. Again, I don't have an example of a statin, but imagine this was, look, we've got a statin. Let's say the GP has prescribed this person a statin. There's atorvastatin. Okay? The patient may have done some research on the internet, and they find out that actually statins have side effects. They can affect your big muscles. For example, they can cause various other side effects. And then he decides not to take the statin. How do you communicate with that patient? How do you reinforce the message to the patient that actually this medicine is important to reduce your risk of having high cholesterol and heart problem? If you don't continue this, with everything that's already against you, perhaps your genetics, your lifestyle, you're at increased risk of developing these heart problems. Yes, there's risk. With all medicines, there's side effects, but actually the chance of you developing this side effect, for example, is 1 in a million in XYZ. Again, how you explain that to the patient is all about communication skills. So yes, 3 skills that you need to think about when you're working general practice.
What's the next role of the technology in this part?
So technology, again, plays a very important role in anywhere that you go. Whether it's a YouTube video, whether it's translation or anything, technology is important, folks. And when you work in general practice, and any of you folks who need help, you're going to have to learn how to use System 1, how to use EMRIS, how to use DocMan. These are all the tools that you're going to have to use in order to be able to communicate, because you're going to have access to lab results. You're going to have access to their medication record. You need to be able to analyze those medication records, get access to those records, make notes on those records. So you can see technology, again, is very, very important when you're going to be working general practice. And we're going to be helping you with this. Because if you're looking for work in general practice and you don't have these skills in clinical decision making, medicines optimization, communication skills, you're not aware of how to use technology, you're going to struggle to get a job in general practice, because they expect you to be trained. Last skill. What was the last skill we discussed?
Empathy.
Empathy, yes. Very important. Why? Because you're dealing with people. You're not dealing with a robot. You're not a robot, are you? No, there you go. Look, she's not a robot. She's smiling. She knows she's not a robot. My point is, when you're dealing with people, you need to be able to put yourself in their shoes. Because ultimately, whether you're working general practice or you're in community pharmacy, what we are trying to do is improve access to healthcare, better health outcomes. And we find that if patients are able to trust their healthcare provider, able to understand information, get evidence-based, and you work in partnership with patients, patient-centered care, you're going to improve health outcomes. Okay? Wow.
It was nice, Faheem.
I really hope you found this video useful, because in the next video, we're really going to be talking about salaries in general practice, how you need to develop your skills in diabetes, hypertension, because there's 12 long-term conditions that you need to get comfortable with.
Yeah.
Diabetes, hypertension, asthma, COPD, Parkinson's, epilepsy. I can't remember the rest. That's 6. And the next video we'll talk about this. Thank you for watching. Ilyas, he'll do the rest.
Well, thank you. Please do like, share, and subscribe.
And if you need help with the DPP and you're struggling to develop your clinical skills, this is the person you want to get in charge with.
Yes, and even we from the February we are going to start for this like CPD.
Yeah,
courses.
what he's saying is, and I'll explain, is we're doing CPD courses live. Get in touch. We'll be sending you that information, and you can also get access to the recordings as well. Thank you for watching. Hey everybody, it's Faheem, pharmacist prescriber, and I've got my colleague with me here today.
Hi, myself Mohammed Ilyas. Actually, I'm a student mentor who works closely with the pharmacists. And today, in this video, we're gonna explain the things how the pharmacists work in the general practice.
Brilliant. So, like Ilyas said, this video is going to be about all of you folks who are either thinking about going to general practice, perhaps you're already working in general practice, or you want to learn more about what is the role of a pharmacist in general practice. So like always folks, subscribe, like and share, and let's get into this video.